Okay, boy, that was an outstanding outstanding talk from Dr. Cordova. So Dr. Cordova talked about stem cell therapy and gene therapy for Parkinson's. My job is just to present you a few slides. I just combed the literature and tried to see what's going on with stem cell therapy and gene therapy and other movement disorders outside of Parkinson's. There's really not much. In fact, this is one of the questions I asked Dr. Cordova, whether there was much action, in the arena outside of Parkinson's, and he curtly said, no, there's none. So, and true enough, there's really not much out there. So, but let me just highlight a few things that I found in literature. For instance, many of my patients that have been diagnosed with Parkinson's and then down the road turn out not to be levodopa responsive, turn out to have multiple system atrophy. And one of the things we look for in their MRIs when we do this, especially in the more advanced stages, is this so-called hot cross bun sign. So if you use your imagination and imagine a breakfast bun right there, you see a cross, right? You see a cross right there. And this is something we see in MSA, and we don't see this in Parkinson's disease. So in Parkinson's, the MRI is normal, except in more advanced cases when the brain just shrinks all over, so-called diffuse atrophy. But in MSA, they distinctly have this atrophy, which is more focused in the pons and the cerebellum. So back in 2012, there was a randomized trial of mesenchymal stem cells in MSA, and it was not a big study. There were 33 patients. Mainly they did the type of patients called MSA-C. So there's two types of MSA. One that looks like Parkinson's, that's called MSA-P. And these are the kind of patients that really fool even the best movement specialists, especially in the first 5 years. And some of these MSA patients may be levodopa responsive in the beginning, especially their tremors. And here's the kicker. Some of them even develop levodopa-induced dyskinesias, and some of them have even made it to deep brain stimulation. But MSA-C is a different animal, though. So these patients, even from the get-go, have a lot of ataxia or incoordination, or what we call cerebellar signs. So they did patients on 33 patients with MSA-C, and they gave the stem cells either intravenously or through the artery, and then there was a group that was placebo. And what they found was that those that were treated with the mesenchymal stem cells had a slower deterioration in comparison to placebo. And then if you do metabolic PET scans, what they found was the cerebral glucose metabolism, as well as the gray matter density. And you do this with regular imaging, MRI imaging at 1 year. Both of these were worse in placebo compared to MSC. So there seems to be a little bit of a response, at least short term. And then this was followed later on, 7 years later, by a study that was headed by Singer et al. From Mayo. And this involved 24 MSA patients, and they gave anywhere from 10 to 200 million adipose-derived autologous stem cells. And these were derived from their fat. And then the stem cells were introduced through a spinal tap into their fluid. And then what they found was that, true enough, the rate of progression was slower in those that received the stem cells versus those that were matched historical controls. And then what about ongoing studies? For those with MSA, are there ongoing studies in the US? And the answer is yes. So there's this ongoing phase 2 study at the Mayo Clinic. Not here, though. You'd have to go to Rochester, right? And this started in 2021. It's going to run until 2025. And they plan on enrolling 76 patients. I'm not sure how many patients they've enrolled so far, given that this kind of started, in the middle of the pandemic. At least they wanted to start in the middle of the pandemic. But they want patients in ages between 30 and 70 with a clinical diagnosis of probable MSA. And this is where a movement specialist or a neurologist that dabbles in Parkinson's and MSA will probably say, yep, you've got MSA, at least clinically based on the criteria. And they want patients that are still able to walk unaided for about at least 50 yards or more, and patients with no dementia. So they plan on doing 3 groups. So one where they'll introduce 25 million mesenchymal stem cells into the fluid in your back every 6 months times 4 treatments. And then the second group, the same deal, every 6 months times 2 treatments. And the third group will be placebo. And then they're trying to monitor the scale called the MSARS, which is a scale very similar to what we use in Parkinson's, except that it's more specific for MSA patients. And they're looking for the change from baseline to 12 months. And then what about PSP? So again, even more disappointing. There's really not much going on in PSP. I just found, just a couple of case reports. And PSP patients can also mimic Parkinson's, especially in the beginning. So one of the highlights of PSP is that they have limitation of eye movement. So if you notice this cartoon over here, patient is made to look to the left, that's fine. Patient is made to look to the right, fine as well. But if you make the patient look make them look up and more so look down, they're not able to track or move their eyes. And so this is something that we see in more advanced cases of PSP, which can be absent in the beginning. So there's just 2 case reports on PSP. So and both were outside of the US. So there was this 71-year-old gentleman from Korea with PSP treated with 5 IV infusions and 4 intrathecal infusions, meaning fluid in the back, with autologous adipose tissue-derived stem cells. And over 6 months, they thought that the PSP rating scale improved gradually, and the balance of the patient improved as well. And there was a separate case report more recently from China with severe PSP. This time, they took the stem cells from the umbilical cord, and his neurological symptoms seems to have been reduced in terms of rate of deterioration. And his muscle rigidity apparently improved. And he still remains alive for more than 8 years, which is quite remarkable since PSP is a more rapidly progressive disease. What about essential tremor? Really nothing as far as the literature is concerned. I also checked the clinicaltrials.gov. There's really nothing going on in the arena of essential tremor for stem cells and gene therapy. And then Huntington's disease, the very first one was done in Brazil. This was in 2017. First is, just to find out whether it was safe, and then sure enough it was. It was a very small study, and then this is followed by a phase 2 triple-blind placebo-controlled study, and they found out that it is the higher dose of stem cells that work. And now there's an ongoing study, a phase 2 extension study, 24 months, which will include 35 subjects. But that's in Brazil, though. And then what about in the US? So there is an ongoing phase 1, phase 2 randomized double-blind sham control study for RAAV MIHTT total Huntington gene lowering therapy. They call it AMT-130. This is a form of gene therapy that lowers the so-called Huntington protein, which accumulates in patients with Huntington's and causes the brain cells to die, especially in the caudate. And this is ongoing in University of Alabama. And apparently, it will also be recruiting in Tucson very soon. So let's see what happens in the next few months or years. What about cerebellar ataxia? Nothing going on. As far as trials are concerned, either stem cells or gene therapy in the US. However, in China, if you want to travel to China, southern China, it's not very cold there in Hunan. There's an ongoing trial for SCA1, SCA2, SCA3, and SCA6. And they plan on recruiting 45 patients. They plan on giving the stem cells either IV versus introduced in the fluid in the back. And then, of course, there's going to be a control group. And they're followed for about 12 months. So I guess if you decide to participate in this, you'd have to be there for 12 months, I guess. Huh? And finally, for dystonia, and I checked the literature for focal dystonia, especially cervical dystonia, blepharospasm, really nothing going on in that arena as well.